Just to get started, can you share some information on the Mind Center and the work that you do there with patients and families?
Yeah, at the Mind Center, I consider our team the industry leaders when it comes on to testing and evaluations. And this is what we specialize in exclusively. It's the primary goal of our practice. When we started out, we were the trusted brand for schools. So we worked exclusively with elementary, middle, and high school. And then we exploded into the private sector market, working with parents who came to us frustrated and they left with a lot of clarity after meeting with us.
It can be so powerful to have the information you need to support your child. Absolutely. Now, before you started using QbCheck, what were the challenges that you found in evaluating patients for ADHD?
There were two primary challenges, and one of the primary ones was the rating scales. It's a market that's just heavily saturated with rating scales. I mean, most commonly, a lot of people will go to the pediatrician and the first thing they get is just a packet, right? With here are the parent forms and the teacher forms. And it's like it's one part of the story, but it was missing this other bigger picture of the story that the computerized test captures. And then the other challenge that we ran into is ADHD has three types, right? The inattentive, hyperactive, impulsivity, and combined. But the inattentive type was being like teachers were missing the mark on the inattentive type because they're not the classic kids who are fidgeting or bouncing out of their seats.
Absolutely.
So diagnosing it with those two methods it was really hard.
Okay, gotcha. Now then, when you integrated QbCheck into your practice, how did that work? What did you do?
It was mind-blowing. So we started receiving a lot of requests from parents for virtual testing. And when I started integrating QbCheck, because you guys are the only company I know of on the market that offers a computerized test that can be administered virtually, the results were game-changing. Like, I literally had parents saying, "Can I screenshot this graph?" Like, they were mind blown from just like the visual depiction in the interpretive report of this is how severe your kid's ADHD is, or this is where the lever is for inattentiveness or hyperactive impulsivity type. So.
Okay, gotcha. So they really enjoyed seeing the clarity that the testing provided for how to understand the specific symptom sets, it sounds like.
Correct. Yeah.
Awesome. Okay. As you think about those families, are there any specific cases you could give me where QbCheck provided clarity, maybe gave you that clinical insight that you weren't able to kind of get from those patient reports?
Yeah, we recently had a high school student who historically he's a good student, right? And then he got in trouble with this TikTok video and was on the verge of being expelled. And this is really what prompted his mom to take him in for testing. And when he came in for testing, this was a kid who sat throughout the 3 hours, like visibly with my own eyes, like he looked like he was focused, right? Mom from the interview, she was like, "Listen, I know that something's off with my kid. He really can't focus. So he's not the classic ADHD, impulsive, hyperactive kid, right?" And we got onto the computerized test. I was so shocked that it picked up the inattentiveness. And I literally sat there like, oh my gosh, this totally validated everything the parent said. I mean, and this was a parent who she was like, "Listen, this is an issue. The teachers don't see it as an issue." And she's like, "I've had to tell him he needs to sit on his hands and try to stay focused." And literally when I saw the test results, I was like, wow, this is something that the rating scale did not pick up. All of the teacher rating scales came back perfectly within normal limits. But the computer results were, it was very informative, and I think it provided a very keen diagnostic clarity that we don't generally see in the field.
Yeah, it really is helpful to have that objective piece to your point with the inattentiveness. They can appear outside to be completely tuned in, and if they're not disrupting, our classroom settings are so busy. These teachers have so much on their plates, and it's so frustrating for these families. The parents are tuned in and they know something just seems off.
Mm.
All right, so tell me about how QbCheck has changed those conversations. You've mentioned, parents wanting to screenshot. What are the conversations like after using QbCheck compared to before?
So because we are able to get diagnostic clarity, what I've heard from school teams is I'm able to write clearer IEP goals, more informed 504 plans. So just from the school team perspective, there's a lot of clarity in terms of this is what they need to do, right? From the parents' perspective, those who pursue medication, I've heard them say, and this happens instantaneously in our feedback session, they're like, I have to show my pediatrician these results. And parents are actually interested in doing like a 3 to 6 month follow-up of, hey, I want to see when my kid's on medication, I want to be able to track these symptoms of inattentiveness and hyperactivity. So it does act also as a progress monitoring tool that has been incredibly informative.
Yeah, no, I was going to ask you about what the parent feedback has been, but it sounds like they're really enjoying a better understanding. And to your point, the test is FDA cleared, not just for use at the time of diagnosis, but also for treatment response evaluation. So that brings such a peace of mind to a lot of our clinics, patients, and families to understand how treatment, whatever that treatment may be, is or is not benefiting the patient. So that's really encouraging to hear that you're having the same experience as well.
Yeah.
Okay.
And actually, just like a fun fact, though the cases and the scenarios that I've shared, just coincidentally, both parents, one's an educator and the other one's an educational attorney.
So they're pretty well versed in how this is supposed to go.
Right. Yeah.
It is, it really is a powerful example of the impact of data. We have a university professor who, when I went to train his team, it was all the new residents and fellows. And he said to them, well, if I have pneumonia, what would you do? And they raise their hands and they say, oh, I'd order a chest x-ray. And he said, okay. And he goes, and after I finish treatment, what would you do? And they raise their hand. They're like, I'd order another chest x-ray to make sure symptoms are resolved. And he's like, right. So why aren't you doing that with psychiatry and ADHD?
Profound. Oh my gosh. Yeah.
And I think that is what we are seeing is highly skilled, highly educated clinicians are expecting more and more for their families and more for their students. They want to have confidence in the processes that they're putting in place and the outcomes that they're finding for their patients. That's exciting.
Yeah, it's interesting because I'm a part of a moms group on Facebook, and I cringe every time these moms are like, I need my kid diagnosed for ADHD. And they're like, yeah, just take them to the pediatrician. And what we're actually seeing, Ashley, is especially when it gets to high school level, right? We had a recent case where the parent submitted pediatrician note, psychiatrist note, because the kid was on medication for ADHD. Legitimate diagnosis, right? Okay. The college board actually declined accommodations and wrote the parent a letter stating you need a comprehensive psychoeducational eval. And we had to administer not only the rating scales, but we administered the computerized test, which the parent was like, I didn't even know that this existed. And I was like, yeah, this is why it's so important to do it thoroughly. So when we look at high school kids who are looking for college accommodations, this is the way to go. It's this level of detail that the College Board looks for. And then also for kids who are just elementary and middle school, this is what the school teams are looking for in terms of writing informed IEP and 504 plans.
100%. I know from my time working in a charter school here in Central Florida, when we were able to create the right accommodation plan and a student was able to have the movement that they needed to be able to stimulate their working memory and allow them to continue to engage in a way that wasn't disruptive, but also supported their brain and its
Right.
needs, we were able to see them thrive. And that is a huge difference maker if we can understand the type of symptoms the patient is having. And so I'm really glad to hear that you're having that experience and your patients are benefiting from it clearly. I wonder what you would suggest to clinicians who are a little hesitant about adding objective ADHD testing and even remote testing. What would your recommendation, or what would you say to those clinicians?
I'd sum it up in 3 words: just do it. It's one of the it's just one of the best investments. And as I said, we specialize in testing. Like, we've seen it all. This is really one of the best investments that you could make for your private practice and for the families that you work for. We've had a 100% hit rate with just parents being really happy, pleased, informed. They leave feeling validated. It clears up a lot of frustration for them. And it's the way that the market's going, right? So parents are looking for convenience. They're looking for, hey, if I could just set my kid up on a Saturday in a quiet room, it would be a lot better. So the digital market is exploding, and it's not a market to oversight at all. It's definitely one to jump in.
Yeah, that was going to be my last question for you is, looking at this trend of evidence-based tech-enabled treatment, where do you see QbCheck fitting in? But it sounds like you feel like it's found its place.
Yeah, and I think you guys have a very seamless and smooth onboarding process. My onboarding was initially with you. I found it to be very informative, but also so personable, right? And then just the one-on-one training that followed that, it definitely had a personalized touch. So it didn't feel as like, all right, this is just another product.
Yeah, I think that the fact that we are able to provide clinical support and training provided by master's or PhD level clinicians who have a broad experience base in ADHD testing and treatment, and know a good deal about the data and the research, because there's 50 or more research studies behind QbCheck testing at this point, and having that data behind us as we're providing the training, whether it's our initial contact like we had, or the training that Dr. Weir provided you for your onboarding session, or in future clinical support calls. If you reach out, you have that support to ask questions if you have those challenging rule-ins and rule-outs. Knowing that we have data on the role of QbCheck testing in ADHD and autism comorbidities, or ADHD and bipolar comorbidities, just really builds confidence for our clinicians as they begin using this with patients and families.
Yeah, I would agree wholeheartedly. And I'm so happy to be a part of the initial phase, because I know when this thing really takes off, a lot of clinicians are going to find a lot of value in it.
And we are really excited to have you on board and to have you supporting, the patients and families that you are. The school setting is close to my heart. And I really think that when we are able to have that crossover, like school-based health, when we're able to have integration of effective medical evaluations reaching the school setting, we know that we're setting those students up for success academically and socially. And we know that that's going to have a huge impact in their long-term mental health. So I think it's just the perfect package. So we're really grateful for your support and your use of the test.
Well, thank you.